Good afternoon, everybody. Myself, Sakshi Shandilya, working as a senior physiotherapist in Orthocure clinic. I'm really sorry we couldn't start at 3 because there was some technical issue going on. So we are starting our webinar now. So I would wait for 5 minutes. I would wait for 5 minutes to join people, and then we can start with our webinar. Okay, so let us start. So today in this webinar, we are going to discuss about lower back pain in young individuals. What are the causes of that pain and how we are going to manage it. Back pain is one of the most common problem facing by the people these days. Why this is so common? What are the causes of it and how we're going to manage it? Let us discuss that. Okay, what are the root cause of this back pain? There are various causes of back pain. One of the most common cause is your bad posture. What is bad posture? So let us discuss about the posture. What is the correct posture and what is the bad posture, and why because of that bad posture we are having the pain. Okay, so we during this pandemic we all are like 90% of us are working from home, and we have converted our dining table chair, our lounges into our working station. So doing that, is it the right thing? It is right until and unless you are not having the pain. But once it starts paining, it starts bothering you, then definitely then there is some issue with that. What is the issue? So the issue is your bad posture or not maintaining the right posture. So what is the right posture? Right posture is sitting upright. So right posture in sitting, let us explain that. Sitting upright with your back supported at back of your seat, arm rested on your armrest, your foot rested on the footrest or on the floor, and the level of your laptop or desktop on whatever you are working should be at your eye level. So that is a near about a right posture. What is a bad posture? Bad posture is बैठे 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 गिर जाना और स्लाउच होते होते हम काम करते करते लेट जाते हैं. It generally happens. So, see, back pain was common when you were working from office also, when you're working from home also. So the reason is we were not maintaining the right posture in the office also. We are not maintaining the right posture in the house also. And in house it is more common because we don't have the ergonomic aid. So it is very important to have the right ergonomic aid at house also whenever you're working, because it is going to support your back. All right. So why we are having pain in back posture? This was what is the bad posture. Now why? Why there is a pain when we sit in a bad posture? So let me explain you this with an example. Imagine you want to build a pillar on a floor. To build up that pillar, you must be needing cement to stabilize the pillar and cement from all the four sides of the pillar. Then only the pillar will stand on the floor, right? Similarly, our spine is acting as a pillar in our body, and it has to be surrounded by the correct and the strong cement, which is our muscles. Muscles are acting as a cement for your spine, and it has to be strong enough to support your spine. Then only it will work in the right manner. Okay, so whenever we are sitting in a bad posture, we are basically altering the right position of our spine. And if the right position of the spine is being altered, it means that the right mechanics or the right position of the muscles are also being altered. By which I mean to say that there are front group of muscles, there are back group of muscles, there are side group of muscles. So all should be working in the right manner to support the spine. In this case, in that posture, what is happening is whenever we are sitting in a slouch position, we are overacting from our front group of muscles since the spine is almost bent, and the back muscles are not working in a proper way. They are getting inhibited, by which I mean to say that if they have to work in a proper orientation with the front muscles, they are working less relative to the front muscles, making them weaker and making the front muscles overactive, which in turn is creating an imbalance between the front and the back group. So if there is an imbalance between both of them, definitely it in turn results to pain. So that is why bad posture is related to pain. Now, the second most important cause of your pain is your disc problem. What is a disc problem? It's a very, very common word term. Many of my patient comes to me and say, डॉक्टर मेरे को मेरा डिस्क बाहर है, मुझे डिस्क बल्ज है. What is a disc bulge? So before telling you that what is a disc bulge, let me explain you a bit of anatomy of our spine. Okay, so our spine is made up of very small bones called as the vertebrae, and in between those vertebrae, we have a very very soft jelly-like structure called as a disc. So this disc is so soft that it has a tendency to come out. Whenever we give extra pressure to that disc, it has a tendency, it will tear out and it will come out. Okay, so and we can see that in our MRIs also, that most of the MRIs, if you go for your back pain, it reports that you are having a disc bulge. Interestingly, if you ask me, if you ask doctor, आप अपना MRI करा लो, मेरा भी शायद डिस्क बल्ज आएगा. But important part here is I don't have a back pain and you have a back pain. मेरा भी डिस्क बाहर है, आपका भी डिस्क बाहर है, लेकिन मुझको दर्द नहीं है, आपको दर्द है. ऐसा क्यों? इसका बहुत बड़ा रीजन ये है, जैसे मैंने आपको बताया कि हमारी जो स्पाइन है वो हमारी मसल से सराउंडेड होती है, and if the muscles are working in a proper way, it is not giving extra load to your spine, and if the extra load is not getting to the spine, the soft jelly like structure which tends to come out doesn't bother us if it is out also. So disc bulge is not a concern until and unless it's not bothering you. By bothering it means डिस्क बल्ज है लेकिन कोई दर्द ही नहीं है, तो शायद आपको कभी पता भी नहीं चलेगा कि आपको डिस्क बल्ज है. वो हमें पता ही तब चलता है जब हमें दर्द आता है. और वो दर्द हमें क्यों आता है? वो दर्द हमें इसीलिए आता है क्योंकि हम उसकी साइड के जो स्ट्रक्चर्स हैं उनको वीक कर देते हैं. दूसरा बहुत इंपॉर्टेंट टर्म जो हमारे डिस्क से रिलेटेड है, दैट इज शियाटिका. लेमैन टर्म में we call it as sciatica. Sciatic is a nerve which is coming from your spine and going to your legs. जब भी हमें पैर में पीछे की साइड दर्द होता है तो पेशेंट्स बोलते हैं डॉक्टर शियाटिका है मुझको. क्या होता है शियाटिका, क्यों होता है शियाटिका? सो जैसा मैंने आपको बताया कि डिस्क, स्पाइन में डिस्क है और जो स्पाइन है उसमें साइड से नर्व्स आ रही है. अब जो नर्व्स आ रही हैं, अगर अगर डिस्क बाहर आती है, डिस्क इज आउट, it is going to compress those nerves. If it is going to compress those nerves are going down in the legs. अगर उस पर कोई दबाव आ रहा है तो वो दबाव आपको पैरों में महसूस होता है. यानी कि if the disc is out and it is compressing your bilateral nerves, those nerves are supplying to your leg and you are having the pain in the leg. Is it question now? Is it treatable? Yes, it is treatable. Yes, we can release the pressure from the nerve and you can get it better. How to relieve the pressure from the nerve? There are various ways to do that. Similarly, like in our clinic, we have a very wonderful machine called as a spinal decompression therapy. As the name suggests, it helps in releasing the compression from the nerves and giving you less pain in the legs or no pain in the legs. And it helps in releasing the pressure from your disc as well. Now the second part which comes here is डिस्क से प्रेशर कम हो गया. डिस्क से प्रेशर कम हुआ, नर्व से भी प्रेशर कम हो गया, पैरों के सिम्टम्स भी बेटर हो गए. बट what is the guarantee it will not happen again? Probably, I have corrected it today. Possibly is that you might get it next week, right? How to correct that? So, to correct that, again, getting back to the root cause, the cement of your spine, the muscles, if you make them strong, they're not going to give you the extra pressure on the disc, in turn, no extra pressure on the nerve, and in turn, less pain or no pain. So, working on the muscles in a right way will help you with the disc problem, will help you in maintaining the right posture, which in turn will lead a pain-free life. Okay, so any questions, any doubt regarding this topic, regarding anything, please write in the comment section. Okay, so next point I'm going to discuss about is very common term heard among us. मुझे डॉक्टर ने बोला मेरा डिस्क बाहर है, मेरे को सर्जरी की जरूरत है. ये बहुत ही कॉमन चीज है. पर इसमें क्वेश्चन क्या आता है, क्या सर्जरी की जरूरत है या नहीं है? और and I would say if people are watching this video, they must have been into the situation where the doctor is suggesting कि आपकी डिस्क बाहर है, आपको डिस्क बल्ज है, सर्जरी करा लो. See, I'm not against any surgery. If it is required, it has to be done. If the surgery is required in your case, even I cannot treat it. You have to go to a surgeon, right? But important part is if it is required or not. How to judge that? 90% of the disc bulge cases get recovered without the surgery, and we are really unaware about it. People go for surgery. What is the guarantee that you're going for the surgery at one level? As I told you, spine is made up of very small bones. There are 33 vertebrae in your spine. 33 vertebrae means in every segment there is a disc. एक लेवल पे डिस्क को काट के हटा दिया, व्हाट इज द गारंटी कि नेक्स्ट लेवल पे नहीं आएगा? और नेक्स्ट लेवल पे भी डिस्क बल्ज आएगा और नेक्स्ट लेवल पे भी वो प्रेस करेगा और फिर से दर्द वापस आएगा, फिर से जाके सर्जरी कराओगे, हर लेवल पे सर्जरी कराओगे? Not possible, right? So the right approach is surgery should be the last resort until and unless it's required. And as I told you, 90% of the patients get better without the surgery. How do they get better? So, अगर मेरे शरीर को ताकत चाहिए तो मुझे खाना खाना है, right? To work in a proper way, in a effective way, healthy way, I need to eat good food. Similarly, for the muscles, the good food is the right exercise. Then what is the right exercise? Patients come. Honestly speaking, patients come and say, "Doctor, मैं exercise भी करता हूँ, पर मुझे फिर भी दर्द है." Then I ask them, "आप क्या exercise करते हो?" Patient says, "Doctor, मैं running भी करता हूँ, मैं cardio भी करता हूँ, और मैं lunges भी करता हूँ, मैं squats भी करता हूँ, और मैं भुजंग आसन भी करता हूँ." Right? You and the people listening to this video, they can relate to it, right? It's a very common practice. People open the YouTube and say कि ये exercise है, मैंने ये कर लिया, क्या आप ठीक हो गए उससे? Then हाँ, this question I asked to the patient, क्या आप उससे ठीक हो गए? बेटर हो गया लेकिन पेन गया नहीं, ये आंसर आता है पेशेंट्स का. So the right thing is doing the right exercise. What is right exercise? Right exercise is जो जरूरत है वही करो. जैसे अगर बैक कमर में दर्द है तो जिस मसल्स को स्ट्रॉन्ग करना है और जिसको स्ट्रेच करना है वही करना होता है. वो कैसे पता चलेगा? यू गेट इट, यू हैव टू गो टू अ डॉक्टर टू गेट इट डन, राइट? The doctor can only advise you which all exercises are the right exercise. Okay. So then doing the right exercise. Second part comes here is a gym going person coming to me and saying me, "Doctor, मैं तो जिम भी जाता हूँ, मैं तो बिल्कुल सारी एक्सरसाइज करता हूँ, पर मुझे फिर भी कमर दर्द है." Then I asked to him, क्या आप जिम में जो एक्सरसाइज कर रहे हो, are you doing in a proper way? Are you strengthening the whole group of muscles? Possibility is a gym going person working more on their abs and not working more on the back. If it is not happening, there is an imbalance between the muscle, and if there is the imbalance, which in turn leads to pain and reoccurrence of the pain, right? Okay, so the second part comes again is there are two groups of muscles in your body. One is your deeper muscles called as the core muscles, and one is the superficial, which are the mobilizers. And generally in every activity we tend to use a mobilizers. And what happens is when we overactively use a mobilizer, we have a tendency to inhibit the core. And since core being the very deeper muscle to your spine, it's the stabilizer of the spine. It gets weak. It becomes inhibited. By inhibited, I mean it's not working in the proper way it should work. And its work is to stabilize the spine. And if it is not stabilizing the spine, we are getting the extra load on the spine and we are getting the pain. So it is very, very important to strengthen the core and strengthen the core plus working on the superficial muscle in the right way. So here we in Orthocure clinic we have this machine called as Medix. Medix, this is for the back. It helps in testing your core muscle and strengthening it. So we prescribe to our patients coming with back pain to get their muscle tested here, and we start with the treatment on the Medix along with the exercises to work on the superficial muscles as well. So, are we clear about it? Why we are having back pain? How we can deal with it? So let's just summarize whatever I have told you. One of the most common problem, back pain, the root causes are your bad posture, which in turn gives extra pressure on the spine, which in turn leads to disc bulge, which in turn leads to the pressure on the nerve, giving you sciatica pain. So how to manage that? To work on that, work on the right posture. If you work on the right posture, work on the right muscles. If you work on the right muscles, the pressure from the disc is relieved, in turn giving you a pain-free life. So doing the right exercise. It's very, I just tried to explain you why, when surgery is required, when surgery is not required, what is disc bulge, in which case you should go to a surgeon. 90% of the people get better without the surgery, which people are unaware about that they can get better without the surgery. And disc bulge is, is a condition which can be treated. People think that they have a disc bulge, वो activities बंद कर देती हैं, they stop bending, they stop doing activities. Please, I request you, visit to a doctor, get yourself checked. You can live a normal life. You can do all your activities if you do the exercises, if you do the treatment in a right way. It is curable. All right. Um, any doubts, any questions, you can just post it on the comment box. We'll answer it. Any questions, anything you want to ask about, any condition, please let me know. I can answer you for that. Okay, so the question is it safe for the patient in pain to start with Medix strength treatment? All right, so Medix, as I told you, it's a device to strengthen up your back muscles, your core muscles. So when the patient is having pain, too much of pain, we don't start with Medix treatment. First, we try to decrease the pain of the patient, right? And then we start with the Medix. Since it works on your core muscles, it works on your back group of muscles. So the agenda is to decrease the pain first. Slightly, if the patient become less in pain, we start with the Medix treatment. Okay, so the next question is, can a person do Medix strength treatment in order to maintain a healthy spine, or it's only for back pain patients? Yes, definitely you can use Medix for strength treatment. It is advisable for back pain patients as well as it is advisable to increase your strength of the back and the neck. So you can use it as your strength treatment. In fact, it is so specific. I would advise that when we use Medex, it is so specific. It works on a specific group of muscles, isolating it without the compensation of the other muscles. It completely works on your back because we are stabilizing your other group of muscles and we just focus on one group of muscles which we want to target. So it is a very, very specific treatment. It's not a generalized gross strengthening, it is very specific. So it is advisable, and definitely in back patients it is advisable because it is so specific for your muscle. Even after doing the exercise, the patient still experience weakness. All right, so the next question here is, even after doing the exercises, patients still experience weakness. How does Medic's back and neck work differently? Yes, it is the case. People after the exercise also experience weakness. Medics and neck medics, how it works differently is it is very, very specific. If I want to work on the back muscles, I will isolate the front muscle, I will isolate the leg muscles. It will work only on the back group. By doing a general specific generalized exercise, we are not isolating the muscles. So that is why that weakness still prevails. But being very specific to the medics thing, the intensity of the pain reduces, the strength increases, and the chances of reoccurrences decreases. That is why it is specific. And you can visit our clinic anytime, it's open, and we have specific devices for the disc problem, for the strengthening of the muscles. As I told you, there is a spinal decompression therapy here, which helps in releasing the pressure from your nerves, which is coming from the disc. It helps in the radiation, which is coming in the legs and in the arms. Plus, we have the medics, which helps in specific strengthening of your core muscles, your back muscles, your neck muscles. Any doubts, anything, please write it down in the comment section. All right, so we are just ending up this webinar. If you have any doubts, you can post it. The video will be available at our page. There is a inquiry number. You can call us anytime. If you want to know about any other problem, any other disease, please write it down in the comment section. Please provide your suggestions to us. Any doubts, any condition, I would happy to deal with it, to talk about it. Please let us know. All right. Thank you so much. Take care of yourself. Be safe. Stay safe. Bye bye.